Hello, everyone. Thank you so much for joining us today. Today we are here with Kate McCormack, who is a social worker with the Kane County Health Department, and she's here to give us some information about what we need to know about COVID-19. So thank you so much for your time, Kate.
Thank you. Thank you for having me today. My name is Kate McCormack. I am normally a social worker, and I work on a children's mental health grant that the county has. But since the pandemic began, I've been working on investigating outbreaks in workplaces and working with employers to educate them about how they can best be protecting their employees. So that's how I came to be doing work around COVID. We've obviously all been living through the pandemic for a long time. So some of this you will know already, and I'll go through some of the initial slides fast. But I do want to start just acknowledging where we are today. So today is December 2nd, 2020, and we are entering a dark and difficult season for the country and also for many different countries around the world. We're entering into winter and into the time of many holidays and parties with the pandemic basically totally out of control in the United States, and that includes Illinois and includes Kane County and Carpentersville. The recommendations right now because of that is that it's not recommended that we celebrate with anyone that doesn't live in our households and that we don't travel. So the most recommended advice right now is to celebrate through how we are right now, through virtual means because of how high infection rates are. So I know that is really difficult for everyone to hear, but that is where we are today, which is again December 2nd, and the situation with the pandemic, as we've all experienced, is that it changes every day. So if there's something in here that ends up not being current, be aware that this is information that was current on December 2nd, but certainly we will learn more and things will update and things will continue to change. So coronavirus basics, again, alert, cases are rising. So most of the information today will come from the Center for Disease Control or from our own health department. And I'm going to give just some of the basic information, again, knowing that a lot of people know this by now, but coronavirus is a class of virus. It's a new class of virus in humans, and it causes the illness that we call COVID-19. Some people have symptoms, other people only have not very noticeable symptoms. Other people have severe symptoms, and as we know, some people get such severe cases that they die. So our basic and prevention steps, of course, are here. Wear a mask in public spaces, stay at least 6 feet apart, and frequently wash your hands. These are the recommendations because COVID passes from respiratory droplets. So respiratory droplets, and they're, of course, sometimes you see them, but a lot of times we don't. And they are just coming out in the air in very small quantities every time that we talk, laugh, or eat. A lot come out when we cough or sneeze, and that is where the particles of the virus are living. The virus can live on objects, but now, after several months of studies, it really does appear that the majority of the time when people are becoming ill is that they are breathing in respiratory droplets of an infected person rather than catching it from surfaces. But the hand washing is partly about surfaces, but the hand washing is also because sometimes we can transfer it from an object to ourselves, but that's why the hand washing is so important. But this is why, again, we keep recommending the physical and social distancing, because it's passing when we are close to people who are infected. So people can be contagious, meaning that they can infect somebody else with the virus before they have symptoms. Oop, I went one ahead of myself there. So that is one of the very difficult things, and a little bit of unique things about COVID-19 is that you can give the virus to someone else 2 days before you even feel a symptom. And then, as we mentioned before, there's also a significant number of people, we don't quite have exact percentages yet, who never have any symptoms, but even though they don't experience symptoms themselves, they still can pass the virus to somebody else. So that's why it's been very difficult to stop, because people, don't even know that they have it yet, and don't have a sign to stay home during those first 48 hours when they're very contagious. So for that, the recommendations have had to be pretty blunt and large, which is to just diminish your close contact with a smaller group of people. Try to keep it to a small group of people. So social distancing, we've all heard that. That's the term that kind of caught on, but in reality, it's really physical distancing. We want to lower the possibility that you are encountering someone's respiratory droplet of somebody that is currently contagious with coronavirus. So the COVID-19 pandemic has really revealed to us some racial and ethnic disparities in infection rates. And so this data is current as of September. So it's not the most recent data, we're in December, but the data has stayed pretty consistently over the course of the pandemic that our Latinx and Spanish-speaking community has been affected disproportionately. And the reason for that is because of the way where people work. So the majority of Latinx and Spanish-speaking immigrant people, specifically in Kane County, for example, were working in workplaces that were deemed essential, so factories that produce essential goods, and were left open during the pandemic, and so during the initial months of the shutdown. So they were exposed to the virus because they kept moving and traveling and working, while other people were able to stay at home. They also work in jobs that require more close contact with people, such as restaurants, cashiers, CNAs, working in nursing homes, deliveries, etc., jobs that couldn't be done from home. So that our infection rates in the Spanish-speaking and Latinx community were really high to start with, and they never really came down. They never got completely under control, and so it just keeps flaring back up like a little fire. If you don't get those infection rates down, then they just keep popping back up. So because they had higher infection rates at the start, that's carried on throughout the pandemic. Now we're getting to crisis levels in other communities as well. But that was an important thing to highlight. So for that, the prevention is super important. We're not going to be able to go back to normal until the pandemic is over, and we need to keep up with the social distancing as much as we can, even though it's obviously everyone's getting tired of it. And we are especially in a very difficult season, as we talked about at the presentation. And they're still recommending that employers have people do teleworking as much as possible, if that's an option for you. And our basic prevention. Okay, and we want to help your community communicate. So what does that mean? We need to be communicating with our loved ones and also anyone we are coming into contact with. And I know these can be tricky conversations to have because sometimes people have different opinions about what feels safe to them and what kind of risks they want to take. But we do need to try to have these hard, open conversations with people in our lives about how we can keep ourselves safe. On a community level, it also means participating in contact tracing. I'm sure people now have heard about contact tracing. In Kane County and most places, it's run through the local health department, which is typically the county health department, sometimes the city health department. And they are going to call to let you know if you have been considered a close contact to someone who has then later tested positive for the coronavirus. Because we're at a point where the cases are so high, contact tracers are again overwhelmed. And so we also are asking people to just do their own contact tracing. So if you test positive or if you have symptoms and you suspect you have COVID-19, let people in your own life know immediately and ask them to quarantine, tell them what's going on. I know that's hard. These are hard conversations, but that's what we're asking people to do to try to protect the community. So if you are exposed to someone with COVID-19, you go into what's called self-quarantine. So staying out of close contact with other people if you were exposed to someone who had COVID or tested positive and you were potentially may become ill yourself. self-isolating. That's the term that we use when you yourself have tested positive. So this would be ideally if you're going to be in your own home, that you're going to be in your own room with your own bathroom, and family members are just going to be leaving food at the door for you during the period of time where you are the most infectious, when you have the most possibility of passing that on. And again, they're learning more every day with different scientific studies. This was originally 10 days plus 24 hours symptom-free. Business complaints. If you're aware that a business isn't following guidelines or taking necessary safety precautions, you can report them to the health department or to the Office of the Attorney General's Workplace Rights Division. The phone number is there. Again, answer the phone if the health department calls. It's been a long pandemic, and so we are all suffering higher levels of stress and anxiety and uncertainty. None of us like to feel uncertain about what is happening. So again, we recommend that you are following, those, everybody says it, those self-care tips, but trying the best that you can to be getting enough sleep, to be eating healthy, to be getting basic exercise, and to be talking openly with the people in your life, especially children and young people, to check in with them, see how they're doing, and talk to them openly about COVID-19 and what's happening, because they're of course paying attention. And we want them to be getting their information from us and not just from their friends or from the internet. But it is a difficult time. We are all living through a collective and personal traumas, often at the same time. So it's really important that we reach out if we need support. One of the options for support in Illinois is something that they developed since the pandemic started. It's called Call for Calm. And you can call or text to receive or you can do it anonymously to receive a call back from a mental health professional who can help connect you with long-term services or just have a short-term conversation with you. Okay, so that's the end of my regular presentation, and then we just have some frequently asked questions.
All right, Kate, thank you so much for all of the information you've given us so far. Can you talk to us about a little bit about what the difference is between coronavirus and the flu?
Sure. So it's actually quite difficult to tell the difference between coronavirus and the flu. So we do really recommend that you check in with your doctor and have a test. So sometimes they will, depending on what's more available in the moment when you're talking to your doctor, sometimes they can test for the flu or sometimes they can test for coronavirus, and that is a medical decision that they will make based on your symptoms and test availability and everything else. So again, we do recommend that you talk with your medical provider. Oh, here I do have a slide on it. So here's some general information, but for you as your own person, when you are sick, it's really hard to tell the difference. So we recommend that you check in with your medical provider and have some kind of test done to check.
Perfect. Can you talk a little bit about what the long-lasting effects of COVID have been on people who've had it?
So it's a great question. We don't really know yet. So there's still a lot of studies and lots of things we need to learn. There are quite a few reports of people having what is being called long haul syndrome, which seems to be kind of like a post-viral syndrome, that have complaints about memory, problems with their memory, problems with digestion, problems with fatigue. There's other people that have had secondary infections of the heart. So we're not really sure. They think that maybe up to 20% of people might suffer from what these are called longer term effects of COVID, going beyond 90 days. But only time and more studies will tell us. For some people, though, this is not a guarantee. Some people do not, or it doesn't appear that everyone's going to have long-term effects. That's just a certain percent of the population. Okay.
Can you talk to us a little bit? I know there are a ton of different masks out there, but can you talk to us a little bit about what masks work best?
The ones you wear all the time. Those are the best ones. So I have a couple slides on this. So your mask checklist, you want to make sure that it fits snugly across the side of your face and that you can secure it with ties or ear loops. So they are not recommending anymore those kind of neck gaiters or bandanas. You want it to be the kind of mask that fits tightly around the face. Has 2 or more layers of fabric, so not really thin if you're doing the cloth ones. Yeah, of course, obviously allows you to breathe. And if you are going to wash it in the machine, make sure it's one that kind of maintains its shape if you're washing it in the machine. You can also wash them by hands in the sink. You can just use dish soap or throw them in the washing machine. Sometimes on these presentations, I say think of them like your underwear. You want to have a bunch and change them every day, especially the cloth ones. There also are hospital surgical masks, which people have. Those are also considered to give a good amount of protection. Those are disposable, though, so you want to be mindful of how many times you're wearing that. I think people are wearing them a couple times, but again, the longer you wear it, the more it's going to lose shape and lose its effectiveness. So I don't think there's any specific recommendations on how long to wear it. I think they are saying you should replace it every day, so that can be kind of a lot. But if you have a special event or whatever, and you want to use one of those are also considered to be good. There's also something called a KN95, which is more available than the more famous N95s, and that's more available to lay people. Those are a little bit of a thicker mask. Those are supposed to offer a good amount of protection. Those can be worn a few times as well, but are ideally would be disposable each time. But those are the ones you're more likely to see like your primary medical doctor wearing. Then N95 is the one that they're going to have in the hospital, or your first responders ideally should be having. And those are not really going to be available to the public unless you're someone who works in a factory. But those are actually fit tested through a process to make sure that it fits you properly and you're breathing. So those are the only kind of masks that are really guaranteed to, they're supposed to not, even probably those aren't guaranteed, but that are considered to be protection against being around someone who's currently infectious with COVID. So that's what they're going to have on typically in the hospitals. And then I think I have one more mask slide. So again, remember with the cloth masks, you want to take it off, and once it's been worn, you want to think of that as having germs on it, right? Because if it's protecting you from COVID, it might have COVID on it. So we want to take that off, put them right in the washing machine, or if you're going to wash it in the sink, put it into a Ziploc bag if you're going to wash it later, and then wash your hands. So once you start touching that mask, then we want you to wash your hands. Okay, any other questions?
I do have a couple. Can you get COVID after having it, after you've already had it?
Yes, but it's not very common. They have a few documented cases, and actually if you know somebody and watching this, or you have documentation of someone who's had it twice, they do want you to contact the health department and let us know, because we're trying to learn more about it. But again, it's such an unusual phenomenon that we don't even know much about it. Is it theoretically possible? What we know today is that for the most part, they think people have pretty good immunity for 3 months. So we still need to follow the precautions in the community of wearing a mask, and when you're at the store wearing your mask and everything, but it will be more able to freely visit with family. And this is definitely one of those ones that's probably going to change. So this is the recommendation as of December 2nd, but they may find out that immunity lasts a bit longer than that. I think they're thinking it might be longer, but we don't quite know. So as of today, it's 3 months. And then you need to go back to your routines as if you had not had it. That's the current advice.
Okay, perfect. If you have somebody in your life who is COVID positive, can you be with them while they're positive if you wear a mask?
And so the ideal answer is no. So the masks offer protection, but if you're with someone for a long period of time, just kind of we were talking about the different types of masks, just your like regular cloth mask, surgical mask, is not going to be enough protection to guarantee that you're not going to get COVID. So the recommendation is if you try not to be around someone, but if you have to be around someone, the mask is better than no mask, of course. So if you're taking care of somebody in the home, that's where they should be isolated as much as possible in their own room with their own bathroom, and you're just leaving food. But of course that is not going to happen and people are disabled or young children or things like that. So then you just take as many precautions as you can take to decrease your risk. So maybe you wear your cloth mask and you wear a face shield, or if the person who's ill is able to wear their mask and you can both wear masks, that's going to give you more protection. And again, be washing your hands as much as possible. But if you are taking care of someone who is COVID positive, then you will have to quarantine after they get better.
Okay. Now, there's been a lot of different information out there regarding the different tests. Are the same day test results as accurate as the tests that take longer?
Again, as of December 2nd, they are not. But this is one that's changing all the time and technology keeps getting better. But right now the rapid tests, we do accept a positive on a rapid test as being pretty accurate. So the health department, if you test positive on a rapid test, the health department counts that as you being positive and asks you to follow all the recommendations based on you testing positive off a rapid test. However, if you test negative on a rapid test, particularly if you're someone who is a close contact or part of a workplace outbreak or something where we quite suspicious that you had a lot of exposure to COVID, they absolutely recommend that you take a lab test or a PCR test to confirm the negative test. So a yes on a rapid is reliable, and a no on a rapid, you need to talk with your healthcare provider. They're often going to want that confirmed, that it's actually negative, because we tend to get more false negatives on the rapid testing.
Okay. And while we're talking about testing, can we throw self-tests in there? Are they reliable?
This is another one that as of December 2nd, with the information we have, they are not recommended currently by the health departments. Probably, again, this will change shortly, but it's not clear yet if they've been approved by the FDA, and there's just still some questions around them. So it's still recommended right now as of today to get the rapid test or the lab test done through a provider.
Perfect. And then I think you and I had talked before the presentation, and I think that you may have a little bit more information on sort of the hot button topic that everybody's talking about right now. What's going on with the vaccines?
We're very excited. The vaccines have, even here's my nurse in PPE. Forgot to put that one up. So lots of hope on the horizon with the vaccines. There are two ones that are really progressing along quickly, and a third that looks promising as well from different companies, and that's great because we're going to need to vaccinate people at such a mass scale that we need as many vaccines as we can get that are working effectively. So right now, and again, of course, this is all going to change, but they think that the vaccine should be ready for the general public as early as April. And we'll be looking at first distribution to people who work in hospitals, nursing homes, and maybe some other high-risk categories, getting vaccinated possibly as soon as the end of December or January. But this is one that's just changing every day. But they're both, the original two are both, I want to say 95% effective, which is so hopeful. So there is hope on the horizon. So we're going through a dark winter, but a lot of hope for the spring.
Amazing. Thank you so much, Kate, for your time, the work that you do, and everything else. We appreciate all of the information. There's a lot of information out there. It's hard to sort of put together what's coming from a reliable source. So I appreciate all of your time and the work that you do.
Yeah, thank you so much too. And I know you're going to share some more resources. And again, there's lots of disinformation and myths out there. So try to get check sources for things. So we recommend Centers for Disease Control and Prevention. You can check the Kane County Health Department, or McHenry County is our neighbor health department up here too, or the Illinois Department of Public Health. Thank you so much again for your time, and take care.
Again, Kate, thank you so much for all of that information. I just wanted to share with everybody some both national, state, and local resources that we have here in the community if there is any needs that your family has due to the pandemic or just due to life. So first I want to talk about the National Suicide Lifeline. The phone number is there. They're available 24/7 if you or anybody you know is having thoughts of suicide. You can always call your local police department, fire department. We'd also be happy to come out and talk with you or your loved one. We just want to make sure at the end of the day that everybody gets the help that they need. As Kate talked about, we have the Illinois Call for Calm line. You can text or call the number, and there will be a trained mental health professional on the other end of the phone who is available to talk to you. There's the National Domestic Violence Hotline. Just because there's a pandemic does not mean that domestic violence and the normal stressors of life have gone away. So the Domestic Violence Hotline is there. The crisis line is available. The Elgin Community Crisis Center is a nonprofit in our area that specializes in domestic violence, sexual assault, and economic crisis, all sort of crises that can come up from time to time in life, they have someone there who's an expert on it. The thing that I love about crisis lines, whether it be the suicide line, the domestic violence hotline, the community crisis center, is that the person on the other end of the phone is trained to talk to you. It's not just going to be an open line where you're expected to do all of the talking and sort of unload your life's problems. It's going to be someone who's trained there to help you come up with what it is that you need help with, what they can do for you, and then help come and connect you with those services. Down here at the bottom, I do also want to point out that there are options if your family is struggling with food and other resources such as that. There's the Fish Food Pantry at 150 South Kennedy Drive, which is over by the movie theater. You can check their website, their Facebook page for more information on their hours and eligibility. There's the D300 Food Pantry, which is located behind Carpentersville Middle School. The only stipulation for them is you must have a youth residing in D300 boundaries. It does not have, your child does not have to be enrolled in D300. You just have to live within the boundaries and have a child under the age of 18. The Dundee Township Supervisor, they have a food pantry, they have a clothing closet, they have general assistance, riding cane. They do a lot of different things over at the supervisor's office, so always check them out if you guys are in need of assistance. I also wanted to point out this Help for Illinois Families. This is a program that's put on by the state. We've had a lot of questions recently about rent assistance, different things like that. This is through the Illinois Department of Commerce and Economic Opportunity. This is the website that you go to. You can always just Google Help for Illinois Families. This is the site that you're going to go to. What you're going to do is you're going to scroll down. There's going to be information on what the program is, what kind of services that they can help financially assist with, whether it be the LIHEAP program, temporary shelter, food, medicine. They have all sorts of different things that they can help out with. You just have to complete the application. And as you scroll down here, it also talks about the different income levels to qualify for the program and what kind of documentation you need to prove your eligibility. So what you're going to do is you're going to click this step one button for the pre-application. What this does is this is not the actual application for the program. This is the pre-application. So what you're going to do is you're going to fill out this application, and this is going to get forwarded to a local service provider who is going to be able to then complete your application for the different programming. So again, doing this form does not constitute your application. You then will have to respond to the person who's going to follow up with you from the local social service agency regarding your actual application for Help Illinois Families. If you do have any other questions, I am the social worker here at the police department. My information's all over our Facebook page, our website. My name is Meg Crace. You can always give a call to the police department, and if there's any resources I can help you find, I would be more than happy to help you. All right, thank you so much for watching today, and have a great day.